Hi, welcome back, and thank you for coming to sit down and listen to this video on tips for people with incontinence. Now, incontinence is the involuntary loss of either stool or urine, and it has a variety of reasons. Here we're going to briefly talk about urinary incontinence, which also has different types. Involuntary loss of urine might be due to like stress, like a cough or a sneeze, and that would be stress incontinence. It could be caused involuntary loss with a sudden urge, which would be urge incontinence. It could be a mixture of both. Some people with neurological conditions or just mechanical conditions may have overflow incontinence. And then if you have something inhibiting you from making it to the toilet on time, such as arthritic hands, that would be called functional incontinence. And the only reason why I share all of that is to show you that because there's so many types of incontinence and causes of it, there's not one treatment method. Each one is unique. So this video is technically geared towards individuals that have more stress or urge incontinence, where their particular involuntary leakage is due to weakness of the muscles. Okay, so the pelvic floor is the floor of muscles under your pelvis that supports and holds up your organs and controls the passage of urine or feces through. It is called the pelvic floor, and it's a hammock of muscles. And the hammock has 3 layers. The bottom 2 layers have a type of muscle fiber that is fast, powerful, but it really doesn't have endurance to it. And the top layer, the 3rd layer, that's where we have our lift and our endurance, but we don't have our power there. And the only reason why I'm explaining that we have 3 different layers with 2 types of muscle fibers is to inform to explain why, if you have weakness of those muscles, it's good to do both exercises that challenge power and challenge endurance, and perhaps alternate between. So that's the reason for me explaining that, and I will give you some examples as we go. So the pelvic floor, like I said, it's those muscles. The first thing that someone needs to be able to do is recognize those muscles. And one way to do this is through the tinkle test. And a tinkle test is where you sit on the toilet and you use the muscles of your bladder or your pelvic floor to stop the flow of urine. That is the tinkle test. I don't recommend doing it as an exercise, but if you want to know where your pelvic floor muscles are, you can do that to give yourself feedback. That is the first step, is to recognize those muscles. The next would be to practice activation and relaxation. We need to relax the pelvic floor as well. Just like the diaphragm lowers and recoils back up, the pelvic floor does the same thing. So we need it to relax down, and then we need it to tighten back up. So that's where you can practice activation and relaxation. I tell people, my residents personally, the ones that I know that have just your pelvic floor weakness, to do 25 quick flicks of that pelvic floor once a day. And that's just for the quickness of it. So that would be those bottom 2 layers that we're targeting. Now, the next thing to focus on is the endurance. And so we're going to focus on strengthening that top layer for endurance and lift, holding it, but then relaxing it in between. Think about the diaphragm. The diaphragm, when we exercise it for our 3-dimensional breathing, we bring it all the way down and all the way up. The pelvic floor is the same thing. It's like an elevator. We're going to be lowering it all the way down, relaxing it, and then we're going to be lifting it all the way up when we contract. And since they're opposite of each other, remember the diaphragm, your diaphragm is your dome that's underneath your lungs and heart. It faces down, right? Well, our pelvic floor is a hammock that faces up. So you have your diaphragm facing down and your pelvic floor facing up. When you lower your diaphragm by breathing in, that's when you want to lower your pelvic floor. So breathing in, relaxing the pelvic floor. Then when you exhale, your diaphragm lifts, and that's when you squeeze your pelvic floor. It lifts also. So there is a timing between the diaphragm and the pelvic floor. And this is the level that's really challenging. But what I often tell people is when you breathe in, just relax everything. Relax that pelvic floor. And when you breathe out, that's when you squeeze it up. So remember that timing is essential, but it is very, very challenging. So now that you have on your own mastered the recognition stage where you can use your tinkle test, make sure you recognize your pelvic floor. Practice activating it, quick flicks, 25 once a day. And then now we are focusing on endurance. So with all of our exercises, you can incorporate your pelvic floor. And here's an example. I'm going to do our arm raises. So when I breathe in, I relax the pelvic floor, right? But then when I exhale, then I'm going to be squeezing up and pulling up that pelvic floor. Okay? And then I relax it. And then guess what? When you exhale, you pull in that pelvic floor. Same thing with our lower body. When we do our exercises, I can relax it when I do my step, okay? But when I press and squeeze, I'm gonna lift it also, okay? So you can include your pelvic floor, those contractions, those lifts and holds throughout our session. And if you're struggling knowing where it is, that's very common. And the more people do exercises, the more they recognize those muscles, and then the stronger they become. So this is a technique that focuses on quick flicks once a day, and then endurance lifts just throughout our session together. So that is one method for targeting the pelvic floor, and that's an exercise prescription that I give to people that just have weakness of those muscles. That is not for individuals that have any neurological conditions, because I think you should consult with your physician first and foremost. This is only for individuals with muscle weakness. So I hope that helps. Also, if you have any kind of incontinence, please drink fluids. And I say this because 99% of my residents that struggle don't want to drink water because then they have to go. And I get where you're coming from. But the problem is when you don't drink your fluids, your urine becomes concentrated. And when your urine becomes concentrated, it irritates the lining of the bladder. And that can cause infection or urges even if you don't have to go. So I highly recommend intaking lots of fluids if you're struggling with incontinence as well. I hope you found this informative, and I hope it provides you with some motivation to follow through with that.